Good morning, and thank you for joining us this morning. I'm pleased, as always, to be here and be joined by Dr. Lawrence Lowe, Peel's Medical Officer of Health, Chief Darren Rizzi from Mississauga Fire and Emergency Services, and Chris Giles, Manager of Compliance and Licensing Enforcement. I hope everyone in Mississauga had a great summer and was able to spend some time relaxing with their loved ones and their friends. I want to thank everyone across Mississauga and Peel region who stepped up over the last couple of months to get their vaccination. As of Monday, 77% of eligible Peel residents 12 plus have received both doses of the vaccine. This is a huge milestone and will go a long way in limiting the impacts of the fourth wave. What's very clear is that the vaccine works. And while case numbers across the region have increased over the summer, it appears they are beginning to show signs of stabilization. This week, Peel region is averaging 37 cases per 100,000, and that's down from 41 cases last week. Mississauga is averaging 41 cases per 100,000, and that is down from 44 last week. The situation at our hospitals is also relatively stable, with 34 COVID hospitalizations at Trillium Health Partners and 9 patients in the ICU. The situation is similar at Brampton's William Osler Hospital, with 27 COVID hospitalizations and 7 patients in the ICU. And having spoken with leadership at our hospitals, we know that the vast majority of COVID hospitalizations are in people who are unvaccinated or only partially vaccinated. Further proof the vaccines are effective at reducing serious COVID-19 symptoms. There are, however, still more than 300,000 eligible residents in Peel who have not received either dose or have received only one dose of the vaccine. And that's why I'm encouraging that Peel Public Health is doing everything it can to make it easier for people to get vaccinated. Focusing on 5 priority zones in areas across the region where there is lower vaccine uptake. The approach involves continuing to work closely with community partners to establish recurring clinics in trusted and frequented spaces that are accessible within the community. And today, Peel region will officially launch the Vax Van, a mobile vaccination clinic at Westwood Square Mall in Mississauga, and will also travel throughout Peel region, offering residents the vaccines in their neighborhoods. Peel Public Health is using data and community insights to understand the needs of residents who have not yet been vaccinated and to provide easy and supportive access to the vaccination. The Vax Van will be at Westwood Square Mall in Malton today, 2 p.m. to 6 p.m., and on Friday from 10 a.m. to 2 p.m. And it will continue to move throughout the community in the coming months. In addition to the Vax Van, numerous neighborhood clinics will run in September, October, and beyond in post-secondary schools, shopping malls, places of worship, fairs, parks, and much, much more. Vaccination hubs at over 15 schools in Peel also launched this week. The easiest way to find out about pop-up clinics and school clinics is by visiting the Region of Peel's website. Please get the vaccine if you haven't done so already. If you're hesitant or have questions, please talk to your primary healthcare provider as soon as you possibly can. Speak to your doctor, your pharmacist, your friends and colleagues who have all been vaccinated, and get advice from them. The more people who are vaccinated in our community, the more likely we will avoid further restrictions or potential lockdown measures over the coming months. I'd like to thank Dr. Lowe and his team at Peel Public Health for working so hard to protect our community. I also want to thank our frontline healthcare workers across Peel and across Ontario. Our frontline healthcare workers have showed us all over the last 18 months what real grit and compassion looks like. taking on huge personal risk to care for the most vulnerable, the sickest in our community. Many of them spend their days providing life-saving care and treatment to patients. Many of them have taken on an enormous burden of being beside patients as some take their final breaths. And that's why I have been utterly appalled by the protests taking place in front of our hospitals by anti-vaccine protesters and those who are opposed to vaccine policies. It's one thing to spread misinformation about the vaccine, but to harass and intimidate healthcare workers and patients as they go into the hospital is simply deplorable. If you want to protest, come here to City Hall, or go to Queen's Park, or go to Parliament Hill, but for God's sakes, leave our hospitals and our healthcare workers and those patients alone. Many are seeking life-saving treatment. Our healthcare workers are heroes. And if any of these protesters were to get sick with COVID or any other kind of illness, our healthcare workers wouldn't hesitate to treat them and take care of them also, because that's what they do. They provide care to everyone. Along with the other GTHA mayors and chairs, I strongly support our enforcement officials in taking any action they deem necessary to protect our hospitals and keep patients and healthcare workers safe. Before I ask Dr. Loh to give his update, I'd also like to thank the Ontario government for releasing more details about its vaccination certification program earlier this week. And I want to remind all Mississauga residents that starting on September 22nd, that's next Wednesday, by the way, they will have to show proof of their vaccination to get into some non-essential businesses. These businesses include gyms, cinemas, restaurants for indoor dining, and nightclubs. Residents will either have to print out or download their second dose receipt until the enhanced digital certificate becomes available on October 22nd. I've already downloaded my receipt and saved it on my phone, and it's been very useful already when entering my local gym, my F45 classes early in the mornings, and other non-essential businesses. The easiest way to download your vaccination receipt is by visiting covid19.ontariohealth.ca. City of Mississauga libraries will be providing free printing services for those who don't have access to a printer at home. Residents will be able to access library computers using their library card or a free temporary pass to access the Government of Ontario website and print off their proof of vaccination at no cost. If requested, and while maintaining privacy, library staff can help residents log into the provincial website and download their vaccination certificate. Proof of vaccination to get into these non-essential venues will not apply to youth 12 and under, as they're currently not able to receive the vaccine. And among other exemptions, youth aged 12 to 17 participating in indoor sports will not have to show proof of vaccination. I'm thankful that the Ontario government has also provided guidelines for businesses on how to authenticate vaccine certificates until the permanent digital certificate is issued on October 22nd. Businesses will verify vaccine certificates by requiring people to show a piece of identification along with their vaccine receipt. A photo ID is not required. Acceptable documents to confirm identity include your birth certificate, citizenship card, a driver's license, a government-issued ID card, your health card, your passport, or permanent resident card. When a resident shows their vaccine certificate, businesses and organizations must verify the name and the date of birth on the receipt, where the receipt was issued, that the individual is fully vaccinated, and that the date of the administration of the final vaccine was at least 14 days ago. I want to assure all businesses that our bylaw team is ready to support you in interpreting the regulation and providing you with all the information you need to ensure you have a clear understanding of the province's vaccine certification program. So please, do not hesitate to call 311 should you need support. Lastly, I just want to remind all our residents to get out and vote. Vote in the federal election, which is being held this Monday, September 20th. Please vote if you haven't done so already. It's so important to exercise your democratic right and have your voice heard. I encourage residents to vote for candidates who will help us here at the city address our issues, address our priorities, such as housing affordability, building transit, making investments in critical infrastructure such as our roads, our community centres, our parks, our libraries, our bridges, and much, much more. We need a federal government partner who is ready to make investments to help us build strong, sustainable communities that keep our residents healthy, connect them to opportunities, and get them moving. So on Monday, please be sure to get out and vote. And now, I'd like to invite Dr. Lawrence Loh to the podium to give us his update. Dr. Loh?
Thank you, Madam Mayor, and good morning. Mississauga is currently seeing new cases at 41.5 per 100,000 this week and a test positivity of 4%. In returning to this podium after the summer break, I need to reiterate the advice of the Ontario Science Table, which was very clear. What happens in this fourth wave is ultimately up to us. At this time, the foundation for protection in our community remains 2 doses of COVID-19 vaccines. The evidence is clear in Canada and across the world that vaccines significantly diminish the risk of hospitalization and death, and that those that remain unvaccinated continue to bear a disproportionate burden on these illness outcomes. That's why I am increasingly concerned about the divisive rhetoric that is building around the vaccine and our ongoing pandemic response. Let me be perfectly clear. All of us want to be beyond COVID and to have our lives back. I would much rather not be standing before you talking to you about the current fourth wave in our community. We have endured so much together. And while this may be hard to imagine, we are now in the most turbulent point of the pandemic where we have to thread the needle even more finely. We have a large proportion, in fact, 77% of our population, that has received 2 doses of protection. And that is the foundation for our exit from the acute phase of the pandemic. But while that proportion of the population is high, we also know that there is a proportion of the population that represents many lives and absolute numbers. 330,000 people, in fact, eligible 12+ residents in our region who haven't yet accessed 2 doses of vaccine at this time. It's this number that keeps me up at night, knowing that our hospital could yet again see capacity challenges and that lives are at stake if Delta finds a way to get in and spin out of control. So I ask all of our residents, please get your vaccines. Please continue to follow precautions. Mask and distance, especially in indoor public spaces and in crowds. Don't meet others if you're sick. Please get tested and stay home. Keep gatherings small and outdoors for work and play. And we need to really take care of each other. We need to take care because we're almost there. These are the same precautions that we've been following for the last year and a half. And as we do so and follow those, we are taking care of each other. And we need to also be kind to each other because ultimately, we're all on the same side. We all want the same thing. We all want out of this and back to normal. But at this point in the pandemic, with so many people who still remain susceptible, it's absolutely crucial that we remain vigilant. We have seen in jurisdictions in Canada and elsewhere that if we throw up our hands too early and live like COVID-19 is gone, COVID-19 will very quickly remind us that it hasn't run out of steam just yet. If we want to return to a world without measures or restrictions, we need to keep working together to get vaccinated and to keep each other safe until this virus is no longer novel to our population. So I urge everyone, especially on both sides of the divisive debate, let's recapture a sense of community and let's work to move past the acute phase of the pandemic in our community. Thank you, and I'll pass it back to Mayor Crombie.
Thank you, Dr. Lowe, as always. And now, Dr. Lowe, myself, Chief Rizzi, and Chris Giles are all here and available to answer your questions.
Your first question comes from Steve Cornwall at the Mississauga News. Go ahead, Steve.
Welcome, Steve.
Hey, Crombie, how are you?
I'm so well. How about you?
Not too bad. I want to ask you first, it appears Maxime Bernier is in Port Credit this morning at a rally. And Dr. Lowe was just talking about divisive rhetoric. So I was just wanted to see if you had a comment on kind of the People's Party holding this rally, and if you had any concerns about, let's say, kind of anti-healthcare fervor kind of spreading in the city further as a result of it.
Well, I'm not making comments about the federal election and individual parties or candidates other than I'm encouraging everyone to go out and vote. Of course, you know I'm no fan of divisive rhetoric or some of the anti-vaccine messages that are being purported. So I hope they keep their messaging to fact and science. And I hope that the rally or whatever gathering they're holding will be COVID-friendly and safe.
Thank you. And on the vaccine kind of passport piece, is there? I was listening to the some city solicitors yesterday discussing it with council, and it struck me as it seems like there'd be a pretty high burden on the city enforcement staffs to ensure that the mandate was respected. Has there been any kind of additional resources paid towards city enforcement staff to kind of get through this next period of time in the pandemic?
I'm going to ask Chris Giles to come up and speak to this as well. But, you know, R311 bylaw enforcement, licensing enforcement have been available throughout the pandemic to our small businesses. In recent times, businesses, as they have non-essential businesses opened, were required to take temperature checks, et cetera, and monitor the stores so that there were safe capacity limits in the stores or in their retail or other organizations or their companies. So they have, I think they're very familiar now with following COVID-friendly rules. And, you know, I think this is one more step and one more layer of protection that they will now check the vaccine certificate, whatever it's being called, not passport, the certificate, as people enter the store. And it'll be as simple as the temperature check that many have been taking in any case. So, Chris, why don't you come up and speak to enforcement issues and what you've been hearing from our business community, please.
Thank you, Madam Mayor. Good morning. In response to your question about additional resources, we've seen this coming for some time, so we're well prepared to respond to any type of inquiry from the business community or the business community at large. And we're in contact with local law enforcement as well through the entire 18 months of this challenge. So we're in good shape to respond and assist the community in any way.
The next question, if Mayor Crombie wants to come back up to the podium.
Hi.
The next question comes from Declan Finnegan from Mississauga. Go ahead, Declan. Declan?
Yes, good morning, Bonnie. Can you hear me?
Yes, Declan, I can. Welcome. Good morning.
Great. Thank you. Good morning. Actually, this might be more of a question for Dr. Lowe.
Sure. I'll invite him up.
But perhaps you might know as well. You mentioned there's 330,000 in Peel who have yet to get both shots. I apologize if I missed it. Is there a number of people that don't even have their first shot yet?
Yeah, I'll ask Dr. Lowe to respond to that. And of course, that universe is people who are eligible to be vaccinated and are either unvaccinated or have only had one dose. It doesn't include people who are ineligible, such as children under 12. Yes. Okay, I'll ask Dr. Lowe to come forward.
Thank you.
Thank you, Madam Mayor. And Declan, just to show you how much these numbers keep me up at night, it's 215,000 people who have 0 doses and 115,000 people who have 1 dose. And we additionally have 207,000 people under the age of 12 who are not yet eligible. Thanks for the question.
Okay, sorry, a follow-up, Dr. Lowe?
Sure, go ahead.
Thank you. Sorry about that. I know in the best case scenario, in a perfect world, you would like to have 100% of eligible people double vaccinated. Realistically, though, there is a number of people that will just, no matter public health efforts, et cetera, that will just not even take one dose. Is there a number or percentage that you would be happy with, that you would feel much more comfortable with beyond the current 77%?
So I think I'm going to provide two sort of sub-answers to your question. I think the first is the science table has been very clear that 85% coverage of the eligible population is necessary to really mitigate the impacts of the fourth wave and Delta in our community as best as possible, especially now that schools are reopening and we're monitoring. So 85, trying to push as high as possible, even to 90%. I know that Chief Kieran Moore has said 90%. The science table has said 85%. So at 77%, 2 doses, we are still a ways away from reaching those levels. But I think the second point that I would make is the reality is at this point in time with so many people having been vaccinated, the virus is no longer novel to those people. And if you have never been infected with COVID and you do not have a vaccine, this virus is as novel to your body today as it was in January 2020. And eventually what's happening is we're chipping away with the vaccine on our one side. That's the easiest way, the 2 doses, you get the protection, you have the side effects, and then the virus is also chipping away at people, right? It's chipping away and sending people to hospital or potentially giving people mild symptoms. And at some point, once the virus and the vaccines have chipped away at enough of the population, it ceases to be novel in the population. That's when we move from a pandemic to an endemic phase. So the reality is, we're really trying to get people the 2 doses of vaccine because we know typically side effects are minimal or mild at best, as opposed to spinning the roulette wheel with infection, because Delta is out there. It's incredibly contagious. We've seen in other jurisdictions, in Florida and Texas and Alberta most recently, that if you're unvaccinated, Delta spreads very quickly. It will find a way to get you. So either it's either the vaccine reaches you first and makes it less novel, or the virus reaches it and makes it less novel for you as well. Thanks for the question.
Next question, please.
Your next question comes from Khalid Salama at My Second Home TV. Go ahead, Khalid.
Welcome, Khalid.
Thank you. Thank you so much for you, Mayor. I wonder, the province downloaded the burden of checking the vaccine certificate to the small businesses. And yesterday, when Minister Elliott talked about this, there was a rhetoric or he said, she said, between Mr. Elliott and the police, because they said 911 is only for emergency. How can you see this and how this will impact the businesses and the employees?
Sure. Thank you for the question. I think that you have to recognize as well that chambers of commerce, the boards of trade have all asked for vaccine passports, vaccine certifications. I understand that the CFIB has expressed some concerns about adding additional burden to small businesses. But as I said earlier, I think that businesses are well equipped and already familiar with checking temperatures, by example, or limiting capacities in their establishments. So I think this will just be one more layer of protection, and they will become very familiar with this procedure in a very short, rapid period of time. With respect to the minister's comments, I think she simply misspoke. And even though we get backup support from our Peel Regional Police, the right organization to phone is our bylaw licensing and enforcement at 311, not 911. Please call 311.
Thank you so much for clarification, 311. So I wonder if Dr. Lowe as well can...
Sure, I'll get him up now.
No.
Oh, okay.
You can either or both of you, please. Over the weekend, I went to the advanced sports, and it was in one of the arenas in Mississauga. I was a little bit surprised because nobody asked for temperature check or anything else. And when I went up for the room for voting, it was very poorly ventilated. And I noticed there is no any special ventilation or filtration. How concerned are you, especially next Monday, it should be very crowded.
Right. You know, it is a concern, obviously. However, people have been given many opportunities to vote in advance polls. I saw myself people in line at advance polls, and they were adequately spaced. They were wearing their masks. You're quite right. I'm not sure if their temperature was checked, but they were masked and they were safely distanced. And of course, there's a mail-in ballot as well if people are extremely concerned and don't want to vote in person. And I, for one, will be voting on Monday on Election Day, as I like to do. And I feel perfectly safe in doing so. Our children are going into those schools, so they're perfectly safe for voters and other residents to go in as well. Dr. Lohr, do you want to add anything? He says, no, I've covered it all.
I really wanted to hear from Dr. Loh as well, because this is really concerning, and he is very stringent.
Yeah, no, thanks so much, Khaled. I would just echo what Mayor Crombie has said. We know that our colleagues at Election Canada have taken measures seriously and are putting COVID-19 precautions in place. I will just add that the time to request a mail-in ballot has passed, unfortunately. I believe you had to apply before September 14th. I myself actually did a mail-in ballot this year, and it was great. It was just sort of like putting it together in a envelope within an envelope within an envelope to send it off. So I really want to encourage everyone, whether you have your mail-in ballots, get those in, advanced polling to help reduce lines and crowding. But if you do show up, I think there are measures in place to ensure that you can exercise your democratic right to vote with health and safety procedures protecting you. Thanks so much. Oh, and by the way, also one thing that you can really do to ease your mind, before I forget saying it, is if you haven't been vaccinated yet, make sure you get your first dose even before Election Day. There's a little bit more partial protection that'll help there, and then come back for your second dose in 28 days. Thanks so much for the question.
Next question.
That was your final question for the day, Mayor Crombie.
Thank you.